Again, the question is, can recovery from drug addiction help people with mental health issues? And the answer is definitely yes, because recovery from drug addiction can significantly help people with mental health issues because it reduces their symptoms that they have from the mental disorder. You see, substance abuse often worsens mental health symptoms like anxiety, depression, or psychosis. And when a person stops using drugs, their mental health symptoms may become more manageable or less severe. I have worked in that field of mental health. I was a psychiatric social worker for many years. And when people who generally who use drugs, they will not take their medication as prescribed or when they should, or if at all, when they are using drugs. And of course, substance abuse does affect your immune system. And so that if you stop using drugs, your brain function does improve as well. The chemistry, you see, drugs can disrupt your brain chemistry and impair emotional regulation. Recovery allows the brain to begin healing, which can lead to better mood stability and clearer thinking. And of course, reduce impulsivity. Because a person who is using drugs is not thinking straight, not only their health suffers, but their judgment is also impaired. Mental health treatment is also more effective when someone is not actively using drugs because drugs, when they use in conjunction with other drugs, it can inhibit or it can exaggerate the effect that the drug is having. So, and I have said on this program several times before, there are a lot of people who um, they use sleeping pills, for instance, in conjunction with alcohol because sleeping pills is also a sedative. So that when the sleeping pills is not helping them because they have developed tolerance, they use alcohol in conjunction with it. And when the makers of the sleeping pills did their formulations, they never tested it in conjunction with alcohol. So that what can happen is that a person can now overdose themselves, without realizing it. Then recovery often includes building routines, improving relationships, reducing stress, all of which support mental wellness. Stability in daily life can prevent or reduce mental health crises because the drugs also affect the mental state. These are mood altering substances. So if you, for instance, suffering with bipolar disorder or depression, anxiety, and so has been in my experience where a lot of people they start to become dependent on drugs, alcohol and other drugs to help them to cope. They self-medicate, as we say. And anyone who works in the field of substance abuse will tell you it's very difficult when a person has become dependent, psychologically and chemically dependent on drugs when they are self-medicating. It is even more difficult to wean them off the drugs. Then, of course, a person who is in recovery often gain a stronger sense of self-worth and life purpose. These are protective factors against many mental health challenges like depression or suicidal ideation. So that definitely when a person who suffers with mental illness and who has also been using drugs, what we call this in psychiatry is comorbidity, when you do not only have one diagnosis, where you suffer with several, you're also drug addicted, but you're also mentally ill. And it has been found that recovery programs, when people are in rehab, in 12-step groups, in therapy and so on, often it provides community support. And this is a very important factor because a lot of people who go to AA, and even though they may have a mental illness, underlying mental condition, because of the support they get from the other people in the group, they are able to manage. And the AA literature suggests in chapter 5 that, even people who suffer with grave mental illness have seemed to be done, have done very well in recovery. Once they have the ability to be honest and they accept and admit they have a problem and is willing to practice the principles of recovery, they too can stay sober. So that community support, the group support, it reduces isolation. And isolation in itself could lead to depression. This is a major risk factor for mental illness, isolation, when you're alone by yourself. And this is why people who are street dwellers and so on, the prognosis for them is not so good because they do not have family or group support. And then an important note here is that co-occurring disorders, that is, people with dual diagnosis, when a person has both a substance abuse disorder and a mental health disorder, now this is very common. Treating both together is essential for lasting recovery and mental health stability. Now, this is a very important point. I want to thank this caller for really highlighting this because I've seen so many people who started off with some form of anxiety because of their schoolwork or their relationship or depression, and they would have gone to their doctor, their psychiatrist, and sometimes they even the general practitioner, and were prescribed a psychotropic drug. I was speaking to a young man yesterday who was prescribed Prozac, you know, and once you get on these drugs, it is very difficult to come off them. A lot of people will tell you that the doctors told them they'll have to use it for the rest of their life. And what happens is they develop tolerance so that the 5 milligram or the 10 milligram after a while will not work and do what it is supposed to do, and you have to increase the dosage. So that what happens in effect, a lot of people start using other drugs, or if they were introduced to alcohol and so on, they start using alcohol to supplement the effect. And now they have a dual diagnosis. They are hooked on two substances. And if you don't treat one, the both of them together, one would cause you to relapse. If you don't treat the mental illness with the medication or what you're supposed to, then the person will become more sick again if you're only treating the substance abuse. And I've seen so many people come to Alcoholics Anonymous and go to rehab and so on. And because they're only concerned about the drug addiction and not treating the underlying illness, in no time, it is very difficult for them to stay sober. So that, I want to thank this caller again. There are many other questions submitted. I'll go to another question that I received from, let's see. This one is from Omar. And what he's saying is, he's describing a situation where his 65-year-old brother is a successful businessman. He does not drink alcohol during the week, but on weekends and family gatherings, he cannot help getting drunk, most times causing conflict, hurt, and embarrassment. He's usually a good guy except when he drinks. Is it possible that he is a weekend alcoholic? And this is, a popular misconception, and I'm really grateful to Omar for suggesting this question, because I know that there are thousands of people in Trinidad and Tobago, and probably millions of people worldwide, who still have this sense that, look, I just take a drink when I'm with friends. I don't drink alone. I don't get up every morning and drink. I don't, because the profile of the average alcoholic is that he is drunk every day. He can't stay sober. He's a vagrant. He's unkempt. He's a very deviant person, all kinds of labels we have. ideas of who the alcoholic really is. So a successful businessman who just takes a drink when he could easily pass as a really nice guy. He's nice to be around and so on. But except when he gets drunk, and you'd hear that being said a lot of time. In fact, when I was drinking, I had that label as well. He's such a nice guy, but except when he drinks, he could become miserable. And so even the person who is drinking is confused as to, no, I'm not an alcoholic. Look, I still have a business that is successful. I have money in the bank. My family is well taken care of. So I think. And I just drink on weekends when I close the shop. Well, let me explain this. How much a person drink, how often they drink, does not really determine whether they are an alcoholic. I'll say that again. How much a person drink, how often they drink, does not determine whether they are an alcoholic. What determines an alcoholic is after they take that first drink, whether they have a craving for another. Because there are people who could take one drink, two drink, and stop comfortably. But there are those who will not drink for the whole week or month or years for that matter. But once they take that first drink, it's though it wakes up a craving in them, some sleeping genie that is only craving alcohol. And they themselves, because I remember how many times I would have told myself and told my family, I'm just going to the shop for one beer. And I honestly meant that. And they would even take out my dinner and say, and I just go for an appetizer. And what would happen? I stay to get drunk. So that is why alcoholism is cunning, baffling, and powerful. Because if you really do not understand the nature of this disease, and I'll tell you, there's so much misunderstanding about alcoholism, even among medical professionals. If you have not worked in this field, you too might very well be unaware of the nature of this disease. So that, yes, a person who is drinking a second part to that diagnosis is once you realize it is causing problems, once you realize it, whether it's health problems, financial problems, relationship problems, once it is causing problems in your life, it is causing you to be unable to follow through with plans you have made or plans with your family, all of those, once it is causing problems and you are aware that it is causing problems and you are still going back and drinking, then clearly you have become addicted. Because if, there are some people who are allergic to, let's suppose, shrimps. So they eat shrimp once and it breaks out a rash. Second time, by the third time, they realize, hey, whenever I eat shrimp, it causes a problem. They'll stop eating shrimp. The same analogy should be used when it comes to alcohol. You use alcohol once, you get into a quarrel with it that you would not have if you weren't drinking. Use alcohol another time, you got sick and vomited and so on. Use alcohol another time, police stop you and charge you. Why are you still drinking? Well, I can tell you, I can answer that. Why are you still drinking is because you have become addicted to it. And in spite of knowing that it is causing problems, you are unable to stop. But although you are unable to stop, you are telling yourself, I could stop whenever I want. It is called denial. And that is one of the features of this disease. It is a disease of denial where the person themselves, other people may see that, hey, the transformation that has happened since this person started using alcohol or other drugs. They could see the deterioration in the person's appearance, personality, character, work, and all of that. And the person themselves, because they are in denial and they rationalize, they don't allow themselves to see. And they will argue and debate up to the end that, no, I don't have a problem. I could drive. Drinking is, I could take it or I could leave it, and because they were able to stay away for small periods of time. They say, see, I don't have to drink every day. Well, as I said before, how much you drink and how often you drink only determines how far you have reached on that continuum of alcoholism. Because alcoholism as a disease is progressive. There are people in the beginning stages who can drink and still manage their business and so on, and their job and their relationships. And then there are those who are in the middle stage of it who now starting to have problems, but are beginning to use denial to cope with it. And then there are those who reach the chronic stage. And those are the people most of us seem to think is the alcoholic, the one who now is in the chronic stage, who has to have a drink every day, who is hands shaking, who is vomiting, who is unkempt and has lost their job and looking like a vagrant and or hanging around the bar all the time or is homeless on the streets. And we tend to keep looking at them. Well, they need to do something about it. And if you speak to them, they will tell you, what's the point now? I've lost my job, lost my family, lost my house, lost everything. And now, if I don't take the alcohol, I will not be able to cope. I'll become probably suicidal. So this is why alcoholism and drug addiction are described as diseases, but they are diseases of denial that keep the person in total ignorance. And they keep sliding down that road to chronic alcoholism and into the gates of insanity and ill health. So I want to thank these two people, Aline and Omar, for submitting these questions. There are other questions, but this program is divided into two segments. We are going to stop in a few minutes and then we have a part two where we have other questions, very interesting questions that I will discuss for the benefit of all our listeners. Now, this is the reason for this program, so that people get information, because information is what is eventually going to help those people listening out there to develop insight. When a person is using drug, if they do not understand the role that the drug is playing in their life, they will not develop the insight. It is from insight that they develop the motivation to do something about it. So the purpose of this program is to educate our public, educate those people who have relatives, siblings, brothers and sisters, or children who might have a problem with alcohol, so that you can know that help is available. As I say that, we are very fortunate in Trinidad and Tobago that we have the highest proliferation of AA and NA meetings per capita than any other country in the world. We also have treatment and rehab facilities here. We have private practitioners like myself who can provide counseling. In my case, I provide acupuncture as well that can help to deal with all the withdrawal symptoms. When a person stops using drugs, whether it be prescription pills, that is psychotropic drugs, mood-altering substances, or alcohol or cocaine or marijuana, once they've been on these things for a while, once they stop, they go into withdrawal. And withdrawal can be very, very painful. In withdrawal, people suffer with depression, insomnia, heart palpitations, all kinds of things. They hallucinate and all of that. So that they need to be assisted. If they, even though they have good intention, they're well intentioned to stop, if they don't get the help, the withdrawal is so painful that it causes them to go back and use all the time. So that we'll pause here at this stage. And remember, this program is going to be repeated again tonight at 10 p.m. on radio and TV Jagriti. And this is going to be posted on YouTube and Facebook for those of you who would like to take a second look. So we'll stop here and we'll resume in a few minutes with part two of this program.